And from what you're saying then, at that point, you didn't need any further treatment?
The surgeon discussed, he said he'd been to the multidisciplinary team and spoken to the oncologist, and looking at everything, it was very marginal whether chemotherapy would be advantageous. And in his opinion, I would probably be better not having it. And I felt exactly the same. And I was so grateful not to have to go through that. My follow-up then was supposed to be in July of this, just gone. A CT scan 6 months and then a clinic appointment, but they forgot to order the CT scan, so I had to chase that up. So that has happened, and they've seen 2 little tiny shadows on my left lung, but they're not concerned about it. So they're seeing me again in 3 months. So that's ongoing.
Yeah. So there is still that watch and wait.
Yes, absolutely.
You've
absolutely.
had successful treatment, but you're still aware that you need to be followed up.
Totally. And I did actually say to him, the surgeon, I said, I know you're not going to answer me because you can't in some senses, but do you think it'll come back? And he went, what can they say? But it's always on your mind. That is so important, because it's incredible feeling, really, to know that this cancer has invaded your body and it's gone now, but has it? And and early on, during, sort of January, February, March, I found it very difficult to not think about it constantly. However, now I don't. That has faded away somewhat. You're still aware, but that constant all day long thinking about it has gone, which is wonderful.
Yeah.
And I'm busy. I'm always busy. I'm interested in a lot of things, and I don't have time for cancer. Just don't have time for it.
9 months on from your surgery, how are you currently feeling, and how would you explain your lung cancer experience if someone asked you? How would you describe it?
I feel absolutely fine. I feel very well. I'm aware. How would I describe my lung cancer experience? Unsurprising, a little bit scary, residual in the sense that you think about it constantly for a while, unless you're still going through treatment, I guess. But not something that has destroyed me. It hasn't. I aim to live till I'm 94.
And are you still attending the lung clinic? And how often do you have follow-up appointments?
They explained it to me like it would be 6 months, and then if everything's okay, it'll be 12 months. So not too onerous.
Yeah, that's good. And do you have any hints or tips that you would like to share with anyone else who might be preparing for surgery?
Prepare your home to come home to. I would really, really strongly recommend you do that. Get all the support you can from, whoever, be it the medical profession or family. Fill your freezer. And make sure that you feel comfortable with things, in the sense of, like I went back to before, was saying, if you have bad days, don't worry about it, just go with it. Yeah.
What sources of support did you find helped you through your treatment? And what other support would you like to see in place for people with a lung cancer diagnosis?
I found Roy Castle marvellous. There's lots of information. Sometimes I don't want to read that information because I find it a bit distressing sometimes. I haven't had any interaction with anybody else apart from, my GP occasionally. But then I'm quite glad not to have to do that. And the other thing I would say, don't go on the internet. Do not go on the internet. Stay off this. Which is why it is better to access people like yourselves or Macmillan, or to keep in touch with your lung cancer nurse specialist in your hospital. And don't feel afraid to phone them and ask the questions. They are the specialists. And listen to the doctors and the nurse specialists, because they are wonderful.